So you might be wondering which areas of the spine usually has a disc bulge. Majority of the cases, it's either going to be L4-5, between L4 vertebrae and L5 vertebrae, so this disc here, or between L5-S1. The most common one is definitely L5-S1. That's the most common one. The reason for that is because it's the last disc in the spine. So you can see you have all these discs throughout the spine, but this is the last one. So most of the body weight, the pressure of our body goes into the last disc. And that's usually the one that herniates or has a disc bulge. What can cause a disc bulge is usually a lot of factors. It could be that, for example, which typically happens is that there's certain parts of the spine, especially below the L5, below this area that has a problem, which could be, for example, the pelvis. Okay, if one side of the pelvis locks up, it doesn't move very well, it means that the pressure will go to the other side and even into the disc. And so long-term, like long-standing problems, especially chronic problems, of one area of the spine that's locking up, that's not functioning well, will place additional stress onto the disc and cause it to herniate or make it easier to have disc injuries. Okay? The classic case would be that, for example, we bend forwards and we twist and then we come up. Those are the typical movements that can cause a disc. So any type of flexion with rotation can cause disc bulges. And the reason for that is our spine does not like rotation. If we rotate along the axis like this and we bend forwards, additional stress gets placed onto the disc, causing it to herniate or causing it to bulge. So they're the typical movements. So what you will usually hear is that, for example, a patient bulged their disc and they're actually not lifting much. They're, for example, picking up something very light, and then when they come up, that's when they start to get the disc bulge. So it's not always from a lifting injury or something heavy. A lot of times it's because it's long-standing problems, and then you do a certain movement, especially twisting and flexion, that will be the last straw that breaks the camel's back. And that then you get the tearing, and that's when the disc can start to bulge. Okay, so just think that this is actually very vulnerable. They're not designed to be, for example, twisted or flexed. So that's why you have to be really conscious and really careful with your posture, especially if you're lifting or if you're picking up something. Always, for example, bend down, keep your back straight, and use the legs to lift up.